Any Peace Corps volunteers in the audience? Return Peace Corps volunteers. Anyone who's worked in the Democratic Republic of Congo? Okay, a few of you. Well, in the Peace Corps standards, I had been a volunteer in Cameroon. No electricity, no running water, tropical rainforest, next paved road, 6-hour drive in the mud. So I thought, I've done Africa hardcore. I'm ready for work in the DR Congo. Well, maybe not as easy as I thought. This is around 2000, 2001. It's the height of the conflict in the country. And I'm working on an immunization project with JSI, USAID funded, doing child health. And for many years, there hadn't really been much immunization program. Coverage is very low, 15, 20% at a maximum. We have measles epidemics, we have polio outbreaks. So I was in Kikwit, which some of you may have heard because it's one of the origins of Ebola. And that's not even the end of the road. But we're there for a training, and then we're to move into Bandunduville, which is further into the interior and actually at the front lines of the war zone. And we're supposed to take a once-a-week flight. Well, the flight gets canceled. Also not unusual in the Democratic Republic of Congo. So we do the next best thing. We get our 3 land cruisers, we load ourselves in the vehicles for the 14-hour drive up to Bandunduville. And one of these vehicles has our fuel in it because there's no gas stations in this 14-hour drive. There are areas that have never seen vehicles on this 14-hour drive. We're driving along, and about halfway into the trip, I look at the driver, I lean forward and I say, "Où est la route?" Where is the road? For the last half an hour, I have not discerned anything that looks like a road. It's bush, it's mud, it's goats and sheep and other things, but there is nothing that says road. He just looks at me with that sort of, "Oh, you silly American." "On se connaît, madame." We just know where it is. So, okay, I'm starting to get a little nervous. It's getting dark, and we're going to the front lines. Not necessarily a place you want to travel to in the dark, but we don't have much choice. We get there, pull up to the road, and there's a barrier. No one's at the barrier, which is a little disconcerting. Then, all of a sudden, out of nowhere, 3 guys, AK-47s, pointed at our car and at my driver's head. He kind of leans back and he said, you might want to sit back a little bit. I'm like, no kidding. They're going back and forth in Lingala. I don't understand the language, occasional French words that I might pick up. But they're asking us why we're there. They're not used to seeing vehicles. We have no approval. But finally, they managed to get through the barrier. And we go into the town. The town is quiet. No lights, no other vehicles, dead of night. But thankfully, we get there, we check into our hotel, we wake up in the morning, and our colleagues who have ridden their bicycles 500 kilometers, these are medical doctors in Congo, 2 days, very little sleep, on their bicycles to come to a training because they have not had any immunization training. And they're so dedicated to their job. They see patients every day with measles, with other diseases, and they're really dedicated to their work. We start the training, but we have to do, of course, the courtesy visit to the governor. Now, we had been warned that the governor was a little strange. We're like, well, what do you mean? Oh, you'll see. So we get to the governor's house. Well, it turns out that for the 30-plus years that Mobutu was the president of Zaire, this governor had never left his house. He was under self-imposed house arrest out of protest to the Mobutu administration. So what do you do as the new president of the country, Laurent Kabila? You nominate him governor. So, not really necessarily on his merit, but more on his dedication to the rebellion cause. So we go to his house, and now he will never address you directly. So even though we all speak French, everyone is in a collegial environment, I'm sitting right in front of him, he has a way of approaching you, which is, "What's your name?" And you have to talk through his colleague. "Madam, what's your name?" "My name is Lora." Ask her why she's here. "Madam, why are you here?" "I'm here for an immunization training." "How long are you here?" "Madam, how long are you here?" "We're here for a week." This goes on, but then it starts to get a little tangential. He starts talking about the economic situation, and you've seen our roads, and you've seen that we have no vehicles in this town. Everything is bicycles, and we're very poor, madam, and on and on. We say, yes, we're sympathetic, we understand, but we're here to do an immunization training and help them plan their services. So, let's tackle one problem at a time. So we say our goodbyes and we go back to the training. And things are moving fine. We're having, all of our participants are there, and we're going through the training activities, and we're talking about the latest vaccine technology, and we're updating them on how to raise their funds and make sure that they have the cold chain needed for the vaccines. Then we hear some noise outside of the training center, and starts to build into people yelling. And I look around and I see that my WHO colleague is not in the room anymore. So we go to the door, and there is my WHO colleague with an AK-47 pointed at his chest by a man in military uniform. And the poor driver, once again, brought up with an AK-47 pointed at his head. Now I'm going through my head thinking, you know, we're here to do shots with needles. We're not here to do shots with guns. And I'm seeing my WHO colleague getting more and more agitated. He's sweating, he's getting angry. He's like, you cannot have our vehicles. Well, it turns out that the governor had requisitioned our 3 vehicles. Oh. So I'm going through my head thinking, okay, I'm gonna be stuck in Bandunduville. You know, I like my colleague. I would like to see him go back with me. And, you know, how are we gonna address the situation? So quickly I thought, okay, the car with the radio. We need to keep the car with the radio so that I could radio my US ambassador. Of course, that's not true. The US ambassador is not in personal contact with me. But the military guys seemed to buy that, so they took the other 2 vehicles and our poor driver, and then we get into the car with the radio, and we radio the Minister of Health. And the Minister of Health says, okay, you know, I'm sorry to hear this, but let me talk to the president and we'll get back to you. So the day passes, we go back to the training, trying to focus on the immunization activities and talking about the diseases. Day goes by. The next day, finally, our driver comes back, you know, war-torn and dirty, and he said, you know, we're back, the vehicles are back. So we think, okay, things are fine. All travel woes are over. We go on with the training, we wrap up. And blissfully, the once-a-week flight actually shows up this time. So I think, okay, great. Off to the airport. And we see the little 16-seater puddle jumper plane. Thought, okay, you know, it's fine. I can handle a small plane. Air Fox, you know, the probably one and only fleet of the Congolese unit. We step into the plane, and it's a 16-seater, and we notice that 4 seats are taken out. And the 4 seats are taken out for our cargo, part of which is a live goat, completely strapped in, up to his neck, with all of our bags strapped around him. He is arm's length from me. I could reach out and pet him. And we're all looking around at each other like, who brought the goat? But we take off, and he's doing okay, and then I start noticing a fly, like sort of around his nose and face. He gets very visibly agitated, starts, you know, swirling. All the cargo is moving around. The plane is starting to jump, and he's, you know, blah, blah. The pilot, of course, because of course there's no door to the pilot looks back, he's like, what's going on back there? We're like, goat! And most of us on this flight were part of this training, so we're like, who brought it? Take advantage of it. And I'm thinking, you know, I feel your pain, goat. I want to land as much as you do, but I'm not letting you out of that. Well, finally, we managed to land, and I tell you, I almost kissed the ground in Kinshasa, and you do not want to kiss the ground. But we get to the Minister of Health's office, and he welcomes me back, and he says, so yeah, I hear you had some adventures in Bandunduville. And he was like, but, you know, the president told me to tell you that that will never happen again. So what I'm taking away from this is, always have backup transport, and make sure you have a satellite radio or a cell phone. Thanks.